What is anthropophobia? Understanding the fear of people. Life can present challenges that sometimes feel insurmountable. Among these challenges, anxieties can emerge in many forms. One such aspect of anxiety is anthropophobia, a term that encapsulates the fear of people. If you feel a profound discomfort or fear around others, you might be grappling with this condition. Let's delve into anthropophobia's intricacies to equip you with knowledge and mindset shifts that can lead to healing and growth. Anthropophobia versus social anxiety disorders. It is essential to clarify that while anthropophobia relates to a fear of people, it is slightly different from social phobia and social anxiety disorder. Social phobia, which is often considered synonymous with social anxiety disorder, involves a fear of social situations where there is a concern about being judged or scrutinized by others. Anthropophobia takes this a step further, manifesting as an extreme fear that may keep you from interacting with even familiar individuals in various contexts. Are you wondering if you have anthropophobia or social anxiety disorder? It is accurate to say that there exists a spectrum of social fears, and your experiences can determine where you fit. How common is anthropophobia? The prevalence of anthropophobia remains challenging to quantify. While social anxiety affects approximately 7% of the general population, anthropophobia could be rarer and more niche. However, rest assured that you are not alone in feeling this way. Many experience similar fears, and acknowledging them is the first step towards managing your feelings. What causes anthropophobia? Understanding the root causes of anthropophobia can help pave the road to recovery. Often, this fear arises from traumatic experiences or significant life events, such as bullying, social rejection, or even family dynamics during childhood. Cultural influences and personal beliefs about social interactions also play significant roles in developing this phobia. Additionally, genetics and a predisposition to anxiety disorders can increase the likelihood of experiencing anthropophobia. Symptoms of anthropophobia. Recognizing the symptoms can empower you to take the necessary steps for self-improvement. Symptoms of anthropophobia typically include anxiety or panic attacks, intense reactions in the presence of others, often leading to physical symptoms like heart palpitations, avoidance behaviors, actively avoiding social gatherings, public spaces, or even casual interactions privately. Negative thoughts, preoccupations with the idea that others harbor negative judgments towards you, feeling trapped, an overwhelming sense that you must escape social situations. These symptoms can vary in intensity and may not appear consistently. You might experience good days where you feel okay around others, followed by days when the anxiety seems overwhelming. Diagnosis of anthropophobia. To obtain a proper diagnosis, you must consult with a mental health professional. Diagnosis typically involves rigorous questioning about your history with social interactions, the intensity of your anxiety, and how it affects your life. If you experience consistent avoidance or severe anxiety when faced with social situations, a mental health expert could diagnose you with anthropophobia. Do the same situations always cause fear or anxiety? One fascinating aspect of anthropophobia is its variability. The situations that trigger your fear may not always be the same. While you might find yourself anxious in one social setting, such as a gathering, you might feel more comfortable in another, like one-on-one meetings. Awareness that your responses can fluctuate will allow you to focus on building resilience in various situations. Related conditions. Anthropophobia shares similarities with taijin kyofusho, a condition more common in Japan that specifically revolves around fears of offending others. If you find yourself dreading social situations because of the worry of embarrassing yourself in front of others, this may resonate with you. Management and treatment options. If you're grappling with anthropophobia, the following management strategies could serve as your pathway to healing. Cognitive behavioral therapy, or CBT, has proven effective for many phobias. It frames irrational thought patterns and leads you towards healthier coping mechanisms and responses. Gradual exposure is another approach. The stepping stone method involves exposing yourself to social situations gradually, starting with less anxiety-provoking scenarios and increasing difficulty as you grow more comfortable. Practicing mindfulness and relaxation techniques can help reduce overwhelming feelings. Techniques such as deep breathing exercises, meditation, and yoga can cultivate a sense of control. For some, seeking medical options like antidepressants or anti-anxiety medications may be appropriate, depending on your symptoms and consultation with a mental health professional. Overcoming symptoms. You may wonder how to overcome anthropophobia at home. Here are several techniques to consider. Challenge negative thoughts. When you start in on negative self-talk, engage in a cognitive challenge by asking yourself what's genuinely rational about your fears. Social skills training. Practicing skills in low-risk social interactions can ease anxiety over time. Enroll in workshops, join groups, or even practice role-playing with trusted friends. Journaling. Document your experiences, emotions, and challenges regarding your interactions with others. Reflecting on your thoughts can offer clarity and allow you to view your fears with a more pragmatic lens. Preventing worsening symptoms. To ensure your symptoms don't worsen, consider the following. Establish a support system. Lean on friends or family who can provide emotional support and assist you during exposure practices. Set realistic goals. Making gradual changes in your social life, such as engaging in short conversations or attending small gatherings, will lead to small triumphs instead of unrealistic expectations. Stay informed. Learn more about anthropophobia and related mental health issues to empower yourself. Knowledge is your best ally. Long-term effects of anthropophobia. If left unaddressed, anthropophobia could severely impact your social, academic, and professional life. Striving for help can significantly improve your quality of life and broaden your social interactions in the long term. Engaging with your doctor. When seeking help, consider asking your healthcare provider the following. What therapeutic approaches would you recommend for treating anthropophobia? Are any specific therapies or group support statistics available? How can my close family help with my recovery? The path forward. Understanding the most likely causes of anthropophobia can better prepare you to navigate your healing journey. By engaging in self-help practices and working with professionals, you can break the shackles of isolation presented by this phobia. So, will a fear of people ever go away completely? For many, fears may diminish over time with effort and persistence. The key lies in consistently challenging yourself, seeking appropriate treatment, and maintaining a strong support network. Remember, you hold the power to change your story. Trust in yourself and take that courageous step toward a fulfilling life where human connection